So I'm going to be talking about trans-specific barriers and facilitators to PrEP acceptability among transgender women. We've seen low enrollment in PrEP demonstration projects among transgender women and low uptake of PrEP in general among transgender women, despite the fact that many of the studies have included transgender women in the title of their projects. They're not necessarily either well represented or well understood. So this study is a qualitative study of focus groups and interviews, and it does focus specifically on transgender women. There's still a gap in the research related to transgender men, and I'll talk a little bit more about that. So primarily, the lack of information comes from the fact that trans women have largely been invisible in PrEP research. Just like the history of HIV prevention and treatment research overall, PrEP research has repeated some of the past mistakes in terms of aggregating transgender women under the umbrella of MSM and then not disaggregating the results or really looking at the unique needs and experiences of transgender women in terms of HIV prevention and treatment, or transgender women or transgender people are included under the umbrella of LGBT, and as some people say, the T is often silent, or just not considered. And not to pick on the Stigma Project, because I actually really love their resources, although it's largely a white gay male organization. This flyer is really pretty representative of the PrEP marketing that's been done to date in terms of it's really been targeted toward the gay male community without consideration for transgender women's unique sociocultural contexts and really allowing trans women to see themselves in PrEP research and PrEP marketing. So this study involved qualitative data collection with transgender women, specifically in San Francisco. We did 3 focus groups and 9 individual interviews in collaboration with Trans Thrive at the API Wellness Center. Thank you, Nikki. We focused on knowledge of, interest in, and concerns about PrEP for HIV prevention. We analyzed the transcripts, and the results presented here are really specific to transgender women's needs and concerns. And so while transgender women did express some of the more general concerns about PrEP that you see in a larger population, I'm going to focus really on the unique trans-specific needs and facilitators. So like I said, there were 30 women in this particular study. We had a fairly diverse breakdown of race ethnicity, with the largest group identifying as multiracial, mean age of 36. We had quite the spread in terms of education. And interestingly, housing status, most of our participants were unstably housed or marginally housed, which is not uncommon in San Francisco, even among those of us who have access to resources. So in general, knowledge of PrEP was low, but interest was relatively high. And I went to an interesting session yesterday held by Lisa Coons, who presented some great data on PrEP indicators among young transgender women in Chicago and Boston, and also found that knowledge of PrEP was low, but interest was relatively high once they were educated about what PrEP could potentially do for them. So this is really a possible opportunity for us. Some of the facilitators to PrEP acceptability, what trans women felt like they needed, or what appealed to them about PrEP, was the idea of potentially obtaining PrEP from a trans-friendly provider. That was really pretty key in terms of, I need to know that the person I'm going to for something like this, where I'm really having to talk about my sex life and my plan for maintaining my sexual health, I need to know that they're going to be trans-competent, trans-friendly. Not just the provider, but the whole context of the medical setting. Ideally, they would obtain PrEP from the same provider that provides their hormones, who they already have a trusting, safe relationship with. Education about PrEP via trans networks. So they really wanted to hear about PrEP from people they trusted, from other trans people, from agencies that they trust with their health. Most of the information about PrEP, like I said earlier, has been disseminated via MSM networks. And what we can see is that even when that marketing is intended to reach transgender women are not reached via MSM networks. They're not reached or served by the programming that is then designed for MSM or gay men. Risk perception was also a facilitator. So if they really saw themselves at risk for HIV, if they were currently involved in sex work, if they had a current serodiscordant partner, an HIV positive partner, or if they had multiple partners, they really saw PrEP as a really interesting choice for them in terms of protection and a potentially empowering choice in sexual contexts in which they didn't always feel like they had power to negotiate condom use. So here's a quote from one of our participants who's talking about risk perception and acceptability. And she says, some of us, we do sex work on the side, and some of us, we're part of that marginalized community, and we don't really have that much opportunity for employment. So we end up trying to make a quick buck with sex work, and that's a lot of exposure, and that's a risk. And I think that's one of the reasons why I would go for it. So it's really about taking her sexual health into her own hands and recognizing the fact that her context, her life context at that moment, did put her at risk for HIV. This woman is talking about the importance of a trans-friendly provider. She says, sometimes just to find a doctor that's trans-friendly and make sure we're on our right hormones is hard enough. I think there would be trans women who would be scared to take PrEP because it's all about finding that right doctor. Having a good relationship with your doctor, I think, is a very good help, a very good, healthy thing. So you can see why enrollment of trans women in demo projects that really target MSM has been pretty low, because in general, they have not been located in places where providers have had a strong reputation for being trans-friendly. Some of the barriers that they talked about, or some of the reasons they felt hesitant about the idea of PrEP, really started with lack of information. And like I said earlier, despite the fact that these focus groups and interviews happened in San Francisco, where a lot of information and excitement about PrEP has been happening, there have been demo projects, there have been very large clinics, that information had not reached their communities. And so they really had a lot of questions about PrEP. They felt like there was a lot that they needed to know before they felt comfortable with the idea. They were also concerned about interactions with hormones, and really felt like if there was any chance that PrEP would potentially slow down their transition or interfere with their transition in any way, that was a deal breaker. And even though we don't have evidence to suggest that there would be interactions with hormones, because we haven't yet had the hard data to say for sure we know this has been studied, some providers even have said, I'm not really sure how to address a question like that. Also, managing multiple medications. Trans women are more likely to come to the table with other conditions, including being on hormone therapy, which is potentially an oral medication. And they had questions about how they would manage taking that many pills and what that would look like in terms of their day-to-day life. And adding another pill to their regimen didn't necessarily appeal to them. The intersection of HIV stigma and transphobia. Even in San Francisco, HIV stigma is quite high, especially among trans communities. And they felt that because Truvada is the same medication that HIV positive people take, they were afraid that anyone who knew they were taking that medication would think they were HIV positive and somehow use that information against them. And of course, medical mistrust and just general avoidance of medical settings. We're talking about HIV negative trans women. Their primary priority is hormone therapy, and if they can avoid going to doctors for any other reason, generally speaking, they're wanting to avoid those potentially negative interactions, both with a provider and in the waiting room. So here's a quote about lack of information via trans networks. I would love to see stats on trans involvement with PrEP, and I would like to see it talked about a little more, because trans women, just being trans women, are at risk for HIV, AIDS, and STDs. So anything that can deter that risk definitely needs to be had in broader conversations and brought to the same plateau as has been discussed in the gay community. Because I'm pretty sure it's being talked about like it's the holy grail over in the gayborhood, but it's not being talked about over here in Transtasia. I thought she put that very well. So the next participant is talking about concerns about interactions with hormones. And she says, if it stopped my hormone progress, I would be irate because I like to look pretty, and pretty is a soft face. And if hormones do not give me that soft face while taking a pill that's supposed to stop something that condoms do pretty just fine by themselves, that would definitely make me stop instantaneously. And when she said that, she snapped, like, that's a given. So there was a lot of emphasis on the fact that they absolutely needed to be sure that it wasn't going to interfere with hormone use. Medical mistrust, this participant said, most providers see us as gay men, and most don't understand that we're women, and most don't treat us as such. So I've gone to a PrEP clinic in San Francisco before for testing, and I felt completely uncomfortable because I am the only trans woman sitting there, and yet they see me as just another guy. It's like, it's not fair. Everyone has the right to the same health care. So in conclusion, we did see that trans women have unique potential motivators for PrEP uptake that we really need to be paying attention to if we are going to support trans women in adding this prevention tool to their sexual health strategy for themselves. And they also have unique barriers that need to be addressed on their terms, in trans-specific, trans-supportive ways. We absolutely need to disaggregate trans women from MSM in HIV prevention and treatment research. This has held us back for way too long in terms of understanding what trans women need and for thinking that we know more than we actually do. And what about trans men? Well, we do have some anecdotal evidence that trans men are seeking PrEP. They may have slightly different needs and concerns, and Bob was telling me yesterday that pregnancy testing might be part of a PrEP package for trans men. So there are potentially additional needs and concerns that trans men have, but we don't have that data yet. There also is some anecdotal evidence that trans men do feel comfortable seeking PrEP in MSM and gay male serving clinics if that is indeed their identity, but we don't have the data to really know that for sure. So in terms of educating your patients about PrEP or your communities about PrEP, really identifying opportunities for disseminating information about PrEP via trans networks is really important. If you can identify a PrEP champion in your trans communities, have some PrEP forums that are specifically designed to answer questions for trans women and men, that has had some initial success here in San Francisco. You want to discuss PrEP in the context of broader conversations about sexual health and wellness, and even in the context of transition-related goals. Nobody wants to be targeted as a high-risk population. Dealing with patients as in terms of wholeness, their holistic health, and what their goals are for their sexual health and well-being, including their transition-related goals, is really important. Addressing misinformation and assumptions up front. There was some confusion between PrEP and PEP in our study. There was a lot of concern about toxicity of PrEP. And so you'll want to elicit concerns from your patients right up front so you can make sure and address them, and including medical mistrust. This was a great flyer that someone sent me. I think it was Shannon Weber from Chicago House, which I thought was a really great example of PrEP information dissemination that's actually for both women and trans women, but it doesn't actually say trans women anywhere on the flyer. It has the hashtag Girls Like Us, which is a really popular hashtag on Twitter for trans women to talk to each other and disseminate information among each other on Twitter without using the word trans, which not all trans women identify. But it's a very empowering, very inclusive flyer that I thought that's really well done. In terms of talking to patients about PrEP, like I said, eliciting and addressing concerns up front about HIV stigma and interactions, and discussing the potential benefits of PrEP. Decreased anxiety in sexual encounters. Even if someone's using condoms, having that extra layer of protection can really allow someone to enjoy sex more when they, even in situations where they feel like they might not have a lot of power or might experience potential exposure. the empowerment, especially among the sex workers in our study, just saying, this is something that I can do for myself and not have to rely on insisting on condom use with my clients and partners. And in conclusion, this is an old picture. I wish I had Maddie's picture overlaid as well as some of our other, our team has really expanded recently.